recording, scanning room.
Alright.
Hello.
Hi, I'm Salina. I'm going to be your student nurse today. I'm going to close the curtain and provide privacy. I'm going to wash my hands. Are you going to need pain today?
No.
Do you know what the date is?
April 3rd, 2015.
Good. Are you allergic to anything?
No.
Good. When is your birthday?
5/30/95.
Can you verify your last name for me?
Drum.
Can you spell it?
DRUMM.
And how old are you?
19.
Patient looks 19 years old. She is groomed well. She looks showered. She is dressed appropriately for the season. All right, I'm going to start my head-to-toe assessment now. Hair is evenly distributed. Face is round. There are no lesions, bruisings, or bumps on the patient's head, the patient's face, or the patient's neck. Patient is warm to touch. No lesions that are asymmetrical, that have regular borders, have irregular colors, have irregular dimensions, or have any elevation. All right. I'm going to assess your eyes now. I'm going to shine a light in your eyes. I want you to look at my nose. All right, Perla looks good. Her pupils are round, equal, reactive to light, and accommodating. Her face isn't droopy. Her eyes are symmetrical. Can you please pull your eyes down? I'm checking the conjunctiva. They are moist and pink. There's no redness or inflammation. Can you please say ah? Ah. Mouth. The mucosa in her mouth is pink and moist. There are no lesions, bumps, or any bleeding. Her teeth are all intact. Can you pull your gum? Can you pull this out so I can see your gums? Her gums are pink and moist as well. No bleeding or inflammation. Can you say ah one more time? Ah. Uvula is midline. Her tonsils are a +2. All right, I'm gonna check for cranial nerve 5, so can you please close your eyes? I'm gonna touch my pen light to your face and let me know where I touch you.
Nose, cheek, chin.
Good, I'm gonna check cranial nerve 7 now. Can you smile for me, please? Can you puff your cheeks out? Very good. Okay, I'm going to move down to your neck. Neck is warm to touch. There's no jugular vein distension. I'm going to listen to her carotid arteries one at a time. +3 bilaterally. And I'm going to listen with my stethoscope. No brutes present. Now I'm going to check her upper extremities. Her upper extremities are warm to touch. There is no scarring, there's no lesions, there's no bumps or bruises. I'm going to check a capillary refill. Her capillary refill is less than 2 seconds. There's no clubbing. I'm going to check your radial and brachial pulses bilaterally. Radial pulse +3 bilaterally. Brachial pulse +3 bilaterally as well. Can you please grab my fingers and squeeze as hard as you can? Thank you. Her hand grasp is equal and strong. Okay. Now I'm going to listen to your heart sounds. All right. Aortic valve is right sternum border, second intercostal space. Pulmonic is left sternum border, second intercostal space. Herbs is left sternum border, third intercostal space. Tricuspid is left sternum border, fifth intercostal space. And her mitral valve is left sternum border, midclavicular line, fifth intercostal space. I'm gonna listen here for 60 seconds, and because I don't have a bell on my stethoscope, I'm gonna just push harder and go up again, reviewing the valves. Mitral, tricuspid, herbs, pulmonic, and aortic. At the aortic valve, you can hear S2 the best, and at the mitral valve, you can hear S1 the best. Now I'm going to listen to your lung sounds. When I push my stethoscope on your chest, please breathe in. 1, 2, 3, 4, 5, 6, 7, 8. Can you please lift your right arm? 9, 10. Thank you. Can you please turn around the other way so I can listen to your lung sounds on your back? Thank you. 1, 2, 3, 4, 5, 6, 7, 8. Could you please lift up your right arm again? 9, 10. Lung sounds are clear. There's no crackling or wheezing. Her diameter is 2 to 1, 1 to 2. Looks good. Can you please stand up? I'm gonna check her CVA. Tell me if there's any tenderness.
No.
Okay.
No.
Can you please bend over? Thank you. Her spine is straight. There's no curvature. Thank you very much. Can you please sit down? Lay down for me, actually. Okay, now I'm going to assess her abdomen area. Her contour is straight. There are no bumps, bruises, or lesions. Everything in her abdomen is intact. I'm going to listen to the 4 quadrants of her abdomen. Bowel sounds are heard in each quadrant. I'm now going to lightly palpate. Is there any tenderness?
No.
Okay, good. Alright, now I'm going to percuss over the liver, which is a dull sound, and then over the intestines, which should be timpani. Very good. Okay, in the upper right quadrant is the liver and the gallbladder, and the lower right quadrant is the appendix and the small intestines and large intestines. And the lower left quadrant is the sigmoid colon. In the upper left quadrant is the stomach, the spleen, and the pancreas. Okay, now I am going to go down to the lower extremities. Okay, I'm going to check her popliteal pulse bilaterally. It's +3. I'm going to check her tibial pulse. Bilaterally, it's +3. And I'm going to check her dorsalis pedis pulse, which is also +3. There is no edema. There's no edema in her legs. There's no abrasions, bumps, or bruises. Now I'm going to check the Babinski reflex. Her toes curl, which is normal. Good. Okay. Can you please stand up for me? I'm going to do the Romberg test. Can you please close your eyes? She's not moving. She's steady. She's passing the Romberg test. Can you please walk to the end of the carpet and back? Gait is steady and smooth. Can you please sit down? Patient has strong posture, is good posture. And concludes my assessment.